Now we will go to draping of the hip in a lateral position. That is either for Austin Moore or partial hip replacement or total hip replacement. I'll hand over it to Shantanu to proceed with the draping of the hip in a lateral position.
Thank you, sir. So as you are seeing, the basic theme remains the same, that we have to isolate the lower leg with a plastic sheet. On top of it, there is a big cloth sheet and there is another cloth sheet. But important situation in the hip area is the contamination from the groin. So you have to make an extra effort here, making sure give critical attention to the groin isolation. You can use couple of drapes there, but make sure it doesn't get exposed while you are in the middle of the surgery, because that's where very likely a contamination from yourself or your assistant is likely to come into the operating field. So big drapes important. You will need 3 or 4 long big drapes to cover the hip in lateral position, as well as few short drapes. So the video basically would show you these steps in detail. So whenever you're using this plastic sheet, make sure it covers the entire lower limb and both sides. Now the first cloth drape that comes is covering again the plastic sheet and ends. A second long big drape comes. The proximal ends are now taken across the groin area and hold together with the clip. So this is where you are starting to isolate a groin. Now another sheet comes from the top and the two ends of the sheet are taken in the groin area or posteriorly or anteriorly, depending on what is your operating incision, and making it secure that it is covered on both sides. On top of this, we are taking two medium-sized drapes and they are coming from front and behind. So the drapes which are used in a curved fashion doesn't really cover the entire. This is an extra step, using a medium-sized drapes to cover the groin from the front and back. Now the third drape comes, that is going to hold the foot end of the leg in sterile zone, making sure till now your assistant who has been holding the leg has not touched the drape, your sterile drape part or the lower end of the table. So that is one more important step, that he holds the foot away from his body with both the arms in full extension. Once you have done that, then the leg can be left onto the trolley or the surgical table. Now this is a proximal drape which is going to cover the body. The ends of this drape can be used as a curtain, but because there are only, this is a second drape on the proximal side, we would advise a third drape that is going towards the anesthesiologist and making sure the side ends of the arm or support, the hip support, the pelvic support is also covered in this. If looking at this, if you still have a doubt where the low leg is going to come towards the ground when you are going to do a surgical procedure or when you are trying to reduce the hip, that's a stage where an extra drape is being used from the edge of the table towards the ground, making sure during the surgery, during the procedure of reducing the final prosthesis of the hip, we do not want some part of the lower end of the or the surgical table being open and the foot is touching that unsterile zone. So this is an extra precaution for bipolar surgeries, hemiarthroplasties, THR surgeries, that you are making sure that the foot which is going down is not touching an unsterile zone.